Hi everyone, talking a little bit about what is PBMT today. Let's get straight into it because today we're going to understand what is PBMT and its synonyms, and we're going to state what laser stands for and describe the different classes of laser. So what's in it for you? We're going to explain further what PBMT and laser is, whilst providing that overview of the different classes. This is going to enable you to have a bit of a further understanding of sort of what you're working with and why that's important, as well as the different classes. So you can say, okay, well, this device is safer than this, but it's not going to be anywhere near higher a power. So what is PBMT? Photobiomodulation Therapy. And how I explain that to my patients is photo, meaning light, bio, meaning body or the organism, because of course this could be an animal as well, and modulation, or to change as such. It does have a few terms, and photobiomodulation therapy has been sort of the term that's been recognised since about 2015, taking over from low-level laser therapy. But it can also be called laser therapy, light therapy, cold laser, low-powered laser, cold laser. There's so many different things that it has been called over the years, and so having a bit of an understanding of what that means. For me, PBMT is really all about sort of bringing that real definition together, and it's really looking at that higher powered laser therapy that is providing these really good outcomes for our patients. And I prefer to call it PBMT because it allows you to then start educating your patients as to why our devices are something different. So although I'll say, yeah, let's go through for some laser therapy, but really what it's called is photobiomodulation therapy, and here's why. So what is laser? Light amplification by the stimulated emission of radiation. Sounds really scary, and everyone sort of thinks laser is all about sort of James Bond sort of cutting lasers and our industrial lasers. But what we're talking about here with most of our sort of laser devices is that they're around that 650 to 905 nanometer, depending on what we're doing. And now you can see that's all within the red and infrared light sort of spectrum. And it's going to be sort of provided at different frequencies, typically between constant to 2000 hertz. Now we do that, as I've mentioned previously, with a particular time in mind. So anywhere between even as low as 10 seconds, but typically 30 seconds, to up to 45 minutes per sort of session per spot. Now when we combine all of those, we call that sort of the dose rate. And that's how much energy is going into sort of a certain area. But really it's, all of those combined with that stimulated light to make sure that we're getting a change at a cellular level. So without wanting to sort of confuse you too much, there are different types of lasers, and most of ours are going to be around that 2M to 3B, and up to a high-powered class 4. Now we're at the lower end of those class 4s as well. So being aware that, yes, for those high-powered class 4s, they're going to be potentially cutting commercial lasers, surgical lasers, and we're not quite up to that level with most of the lasers that we're going to be using in our clinics, particularly when we're looking at stimulating and healing. Of course, if it's cutting, that's causing more damage. But when we're looking at some of these devices up the top here, they're going to be sort of like your laser pointers and little lasers that we're particularly using up to that class 2, non-regulated, and really the things that you can get off the shelf, over the counter, for different devices that patients are using at home. When we start getting into this 2M, that's when we're starting to get into our more higher powered laser. We're potentially leaving and almost jumping out of that visible light sort of spectrum. It is a lower power, and these are the sort of ones that have been starting to use for dry macular degeneration of the eyes. But then as we're starting to get into sort of our class 3s and up to our class 4, that's where we're really needing our glasses. And we talked about sort of the MPE earlier because that's really important to have a bit of an understanding, because that nominal ocular hazard's all really important here, so that we can reduce that risk of someone having eye concerns. So again, wearing those glasses is going to make sure that we're reducing that risk of injury, because we can't see a lot of the spectrums that we're using. And a lot of the time, the red light that you're seeing pulsing is completely non-therapeutic, because the ones that are therapeutic are there, but we need to know when the when the laser is actually on. As we're getting up to these class 4s, typically there's a little bit more regulation, less so, definitely class 3B, they're wanting that with Western Australia, and class 4, Western Australia and Queensland. There's different devices that are used depending on regulations, if you want to sort of move around that way, but really looking towards those higher class lasers is a really good way to make sure that your duration of treatment is a lot lower, and that patient's going to be getting a more successful and fast outcome from your treatment as well. So it is really important to understand this and be able to explain it, what laser is, and because your patients are typically going to be, okay, well, what's this laser, but when we say it's potentially pain-free, less likely to cause any concerns, it's a really nice way to sort of start explaining that. But understanding laser provides you with the necessary education to demystify it, making sure the patients are comfortable undertaking that laser. But this also gives you a good base level understanding to be able to provide those patients with that good outcome, so that we can start going into further depth with that in the time ahead as well. Photo is light, bio, body, modulation to change. That's photobiomodulation therapy. The dose rate is based on that wavelength, the frequency and time, and the different classes are from that class 1 through to a class 4. This has been What is PBMT, and we'll see you at the next session. Cheers.